The Victorian Agency for Health Information, or VAHI, was established to analyse and share information across Victoria's healthcare system. Throughout the year, VAHI provides accurate, timely and actionable data through several reports to health service boards, executives and clinicians to help them develop strategies to improve outcomes, ensuring Victorians receive the best possible care. These reports show data in different chart types. The most common are bar charts, funnel plots and time series. When read collectively, these charts provide a snapshot of each health service, showing how a health service performance compares to its peers and how a health service is performing over time. For people reading these reports for the first time, analysing the data may be a little confusing, which is why these videos have been developed. Bar charts are one of the simplest and most common ways to visually present data. Most measures across VAHI's reports are presented in a bar chart. Bar charts are usually displayed with health services grouped with its relevant peer group. This enables the health service to compare their own performance against those with health services of a similar type, size or profile. Bar charts are always ordered from most favourable results at the top and least favourable at the bottom. Where available, additional information is provided to the right-hand side of the bars, including previous year's results. There are three ways data is displayed in bar charts: counts, crude rates and adjusted rates. A crude rate is a simple way to display results as a percentage. These are based on available data and are easy to calculate, giving a quick overview of a result. The downside to crude rates is that they don't take into account unique differences in the population that a health service supports, so it can be difficult to provide like-for-like comparisons of results with its peers. Adjusted rates provide each health service with an expected rate based on the population they work with. Age, gender, complexity of conditions, social and demographic information affect these adjusted rates and help provide a better comparison of results. In adjusted rates, 100 is the expected result for a health service. So if a health service result is below 100, it is performing better than expected. Funnel plots are another way to show a health service result compared to its peers. For those reading funnel plots for the first time, they can be a little challenging to understand, so it's best to break it down to show the various components that comprise a funnel plot. The vertical axis shows the result and the horizontal axis shows what is being looked at. In this example, it is the number of anticipated deaths in the population. Just like the adjusted rates in bar charts, 100 is the baseline each health service is working to. These lines in the shape of a funnel, where the chart gets its name from, provide the boundaries of an area in which the health service's results are expected to appear. The left-hand side shows results from smaller health services and the results on the right-hand side from larger health services. Next is the peer group average result. In this example, you can see they are collectively performing better than the expected baseline of 100. Each health service's result is plotted on the graph. Some are above and some below the average, but all that appear within the funnel are shown in blue and are within the expected range. Next are the health services outside the funnel. If a health service is in red, its result is deemed statistically higher or worse than expected. Those in green are results deemed statistically lower or better than expected. Each health service should compare with other services on its vertical axis, as these health services have similar population profiles they serve. For example, the health service BR would compare its results to AD, BG and BU, providing opportunities to find out what they are doing differently to achieve more favourable results. Time series shows a health service's performance over time. In this example, the purple line shows the performance of a health service between July 2016 and June 2019. This red line shows the peer group average result, and the blue and grey shows the range where the results are expected to appear. Time series are a really important way to show increasing or decreasing patterns of performance over time, as well as points in time that may have had an effect of results. An example of this could be an outbreak of influenza in the population that affected the health service's results. In this example, you can see that from January 2018, the results are steadily increasing for this health service, and in this measure it means it's less favourable. It also shows that from June 2018, the health service's peers are steadily obtaining more favourable results each quarter. This would raise the question, why is our result declining and what are our peers doing differently to improve their results? Now we've reviewed the different ways data is displayed, here is an example of why all charts need to be read together to obtain an accurate picture of a health service's result. Let's look at two health services, CQ and ZZ. On the crude rate, CQ has the lowest performance and ZZ is fourth lowest. In the adjusted rate, when we take into account the population they service, both services improve their position slightly. However, on the funnel plot, you can see that because CQ services a smaller population, their result is within the funnel and is deemed statistically no different from services in blue. Whereas ZZ is now outside the funnel with a statistically higher result and worse result than expected, while its closest peer, DB, has a much better result. Finally, when you look at the time series, you can see that ZZ's result dropped dramatically in mid-2018, which would prompt the service to investigate what they did differently at this point and how they can work to improve their result. So while the bar chart didn't show any obvious concerns in ZZ's performance, when you look at the results on the funnel plot and time series, you can see that the result is much less favourable and has been for the past 18 months. The purpose of these charts is to support health services to find ways to improve performance where needed and to celebrate the achievements they are making. We hope this has provided some clarity around the data we provide. For more information about our services or to contact us, please visit our website.